I didn't know how to start presenting these cases because I knew that there will be some resistance to calling these patients different or giving them a name, and that will include revising tens of patients and changing the diagnosis and admitting that they were wrong. It's not always easy for everyone to do that. I waited until I got as much information as I can and listed them all in one simple, very convincing presentation, just a PowerPoint presentation. There was some resistance at the beginning, certainly, several times. And each time I will present a case that is not necessarily like the classic with all the typical findings, the resistance will certainly be bigger, and eventually some of the cases weren't even called CLOVES. Eventually, my colleagues got used to seeing these cases, and the more cases we saw, the more patients we saw with the same disease, the more comfortable the team came to call them that name, and eventually we ended up with more than 80 patients or so. We have to stereotype diseases because if they look the same, they could be the same, and you have to search for something common among them. One of the biggest findings I proved to myself is if you believe in something, even if you have no evidence of it, it's a dogma based on one or two encounters, just continue looking for the evidence and work hard to find the evidence. At one point you may find it.